Hello everyone, we are live. We got sound and everything. Okay, a little bit of technical difficulties there for a second, but we're back. This is Muscle Relaxers, part 2. You already know this is going to be on the test, so please, like I said in the past, some students have not studied the part 2, didn't think it was going to be on the test, but please, this is testable material. Quick presentation here, just a few more medications to go ahead and add to the previous muscle relaxer presentation. First off, metaxalone. This is a generic scalaxin. Pharmacological category, it's a skeletal muscle relaxant. Mechanism of action, this is one that's not fully elucidated, so the precise mechanism has not been established. So I'm going to just read through it, but it's basically thought to be working via the nervous system. But like with majority of my exam questions and stuff, if it's not fully elucidated, mechanism has unknown, just go ahead and study that for the exam. Uses, we have obviously it's a muscle relaxer, so acute pain that are related to the musculoskeletal conditions. Adverse reactions, so the frequency is not defined, but like with the proposed mechanism of action, this medication definitely has effects on the CNS. So definitely put a star by that. You definitely want to be mindful and warn your patients about the CNS depression. So dizziness, drowsiness, in addition headache, some common ones. You notice there are some GI adverse effects too, common adverse effects that can happen. And then rare but serious hypersensitivity reactions. Contraindications, as always, hypersensitivity, significant hepatic or renal function, tendency to drug-induced hemolytic or other anemias. So those are related to the anemias, and then the hepatic or renal function are related to the adverse effects. You'll notice them back here. So please make that connection, and please make sure you're studying contraindications for these medications. Carisoprodol, which is the generic for Soma, another muscle relaxant. Mechanism of action, again, this is one that's not fully elucidated, not completely known, so don't stress too much about it. But again, like with the previous medication, it definitely has some CNS effects. So it's used, like, again, makes sense, short term, so 2 to 3 weeks for acute painful musculoskeletal conditions. But please note here, there are some limitations to the use. It should only be used for a short period of time. So you notice that's on here twice, so please make sure you note that. 2 to 3 weeks. And I was saying, please be mindful of that, just because you will get calls maybe from your friendly pharmacist if you're prescribing it longer term. And this is one that, it's a controlled substance, but it's a C4, so it is one that PAs are able to prescribe. So this is definitely going to be part of your toolbox, so to speak. But then again, just please make sure that it's not for a long term. I've had students ask me, well, they be on it, for multiple short terms? Yeah, that is okay with some spacing between. So, 2 times a year, for example. And again, depends on the person, if they're injury, etc., what specific musculoskeletal condition they have. Mentioned this before, definitely a pronounced effect on the CNS. So definitely drowsiness, you'll notice up to 17%. Is going to be your number one common adverse effect. It's definitely something you're going to have to be mindful of. And like I said, for board questions, my questions, it's, the person operates heavy machinery, then this is something you need to be concerned with. Or if there's something where some activity where they need to be alert and awake, definitely something to be concerned with. And other than that, we have dizziness and headache. Contraindications, going to read through that. Hypersensitivity, and then history of acute intermittent porphyria. Methocarbamol, another muscle relaxant. This one, it causes skeletal muscle relaxation by general CNS depression. So you're noticing a trend here, hopefully, with these muscle relaxers in this presentation, and that you need to be concerned with CNS depression with all of them. Use adjunctive treatment for muscle spasms, and again for acute painful musculoskeletal conditions. Another thing to highlight too, that none of these, theoretically should be for chronic pain conditions. Again, these are acute, or they should be prescribed acutely. And again, it's based off the FDA recommendations. Adverse reactions, again, so frequency not defined. However, definitely you can put a star here by the CNS adverse effects. And then, go and look through the rest of these. But rare but serious angioedema, hypersensitivity reaction, including anaphylaxis. Some GI upset is going to be a concern here as well. Also some cardiovascular adverse effects. But definitely go ahead and read through all those, because as always, it's going to depend on your patient. So if your patient already has vision issues and then this causes blurred vision, that might be an issue. Or if they already have hepatic conditions or hepatic impairment and this can cause jaundice, that might be an issue, right? So definitely read through all of these. But so you need to know the common ones, but it's important to study all of these because it's just going to depend on the specifics of your patient. Contraindications, and I mentioned too specifically your patient. So hypersensitivity, of course, it's always there, and then renal impairment, specifically for the injection formulation. But again, it's going to depend on the patient there. So that is it for me. Thank you guys for your time and attention. I always appreciate it. As always, feel free to email me any questions, comments, feedback, or anything else that you want to. I will talk to you guys later. Thanks again. Bye.